Welcome to the desk. The Vice President, Kashim Shettima, has claimed that Nigeria is witnessing a surge in reverse medical tourism, with patients from the United States and other countries coming to the nation's hospitals to seek affordable and quality kidney transplants. Shettima attributed the choice of Nigerian for treatment to affordability and high-quality expertise with the country's medical community. Well, I have right now in the studio to look at the medical tourism development platforms and talk about this in terms of its revenue that it can generate for Nigeria. And joining me in this conversation is Isah Usman, who is the global tourism developer. You're welcome to the desk.
Thank you. Thank you for having me.
All right. So first, let's establish what is medical tourism.
So, medical tourism simply means traveling from where one is residing to another location in the quest for quality medical treatments, or traveling from less developed country to well-developed country, or from well-developed country to less developed country for quality medical treatments.
Interesting. Now, we've seen the Nigerian Vice President say that more people are coming to Nigeria. You're already smiling. What do you make of this whole conversation? Because it's as if the reversal is the case. More Nigerians are traveling out. But right now, it's kudos to Nigerian because more people are traveling to Nigeria for kidney transplant.
Well, it's so funny. Funny in the sense that in anything in life, there is a procedure for it. There's a way that the right things to do the right things. So saying that people are coming from abroad for medical treatments, it may be true. But the issue there is that good numbers of Nigerians don't believe the statement. The reason why I say so is not far-fetched. Good numbers of Nigeria, I'm talking of 70 to 80% of population of Nigeria don't have access to quality medical treatments. So people will hardly believe. Because medical tourism, there's a procedure for medical tourism. If you want to participate, the country wants to participate in medical tourism, first of all, they have to develop what we call intra-band medical tourism. I mean, domestic medical tourism for the citizens first. The citizens have to start enjoying medical tourism before start going out to announce to people that, okay, we are enjoying medical tourism. Then what our citizens are enjoying, let's you guys come to our country and enjoy what our citizens are enjoying. And by the way, there's nothing like revising medical tourism. There's nothing like revising medical tourism. Whether you are participating in intra-band, in-band, and out-band. And this afternoon, I'm here to debunk the word revising medical tourism. There's nothing like revising medical tourism. So, and today, our local healthcare service providers and those at the helms of affairs, they should stop using this language. It's not good for us, because when we are using this language, the developed countries that have interest of investing in Nigeria health sector will not come because they see that we are not serious. So the right language is for us to say that, okay, we are now promoting, we are into promoting medical tourism. If they ask, is it in-band or out-band or intra-band? What we are doing is in-band and intra-band. So there's nothing like revising medical tourism. Well, so we should stop using that statement. It's not good for us.
When you said that Nigerians are not enjoying medical facilities, I think a lot of Nigerians would disagree with you on that stand, because we have a lot of improved medical services across the country. But then let's even look at the medical tourism field, as it were. We understand that in medicine, talking about tourism sounds strange to a lot of doctors. How come you have been on the forefront talking about medical tourism? It's absorbed even in the medical space.
Okay. Now, I've defined medical tourism before. And medical tourism, you see, and referral of patients, they are inseparable. You cannot separate them. When you refer patients, the patient move, either within or outside. So that is why we have domestic medical tourism, which is also known as intra-band medical tourism. So why there is this confusion is that many Africans, their understanding about medical tourism is outbound. So the school of thought has narrowed down medical tourism to outbound medical tourism only, while the real concept of medical tourism encompasses intraband, inbound, and outbound medical tourism. So medical tourism that they don't want to hear, let me even be honest to you, medical tourism that they don't want to hear is the only solution to the challenges we are facing in our health sector.
How correct is that?
Okay. There are two problems facing Nigeria health sector.
All right.
And what problem gave birth to these two problems? What is that problem? The problem is the way we see health sector. We are looking at healthcare sector with one eye instead of looking at healthcare with two eyes. Health sector is supposed to be looking as a profit and not profit making venture, and that is where we get it wrong. And that is where government is not giving attention that the healthcare deserve. Why is it that government is giving attention to oil and gas and is not giving attention to, because in health sector, since they see it as a charitable organization, nothing is really coming from there. What is the two problems that this problem gave birth to? We call there are two problems. We have problem within the health sector and the problem outside the health sector. Which one is the problem within the health sector? The problem of enabling environment. And who have solution to the problem is government. So government has to provide enabling environment for its citizens, for our local healthcare service providers, so that we can announce them. Then the problem of enabling environment encompasses there's no stable power supply in Nigeria, as you know. There's no good road, there's no water, and most of our policy are unfavorable. So most of the policies are not good for our local healthcare service providers. So government has to make a policy that will favor our local healthcare service provider, and the policy has to favor three parties that involve in healthcare business. Who are those parties? One, healthcare service providers, which are hospital, doctor diagnostic centers, and etc. Then healthcare facilitators, people like us that specialize in business aspect of medical. Then thirdly, the policy must favor healthcare seekers, which are patients.
But you've rightly said. I'm
not done.
All right, please go
because
ahead.
I'm talking of. I talked about problem outside the health sector.
Please go ahead.
Then the problem within the health sector. The only solution to the problem is medical tourism, by us embracing health tourism. We call health tourism a solution in actions. All countries that do well medically worldwide, they embrace it. And immediately medical tourism come to any health sector of the country to start addressing the problem one after the other. What are the problems? Problem of availability of treatments, affordability of treatment, accessibility of treatment, acceptability of treatment, poor success rate, attitude of medical personnel towards patients, medical negligence, medical malpractice, medication error, and healthcare frauds. So the only solution to this problem is by us embrace medical tourism. That is why we call medical tourism solution in action.
Well, Usman, is to a very large extent, when you say medical personnel, it's divided into three. The facilitators, which you've said, the facilitator, the patient and the doctor, healthcare facilitator, the medical doctor is known. The patient are known. The healthcare facilitator sounds very strange in Nigeria.
Okay.
Do one need to go to school to become a healthcare facilitator? What's the criteria? Is this a new field that Nigerians need to explore, or it's an adopted phrase that was used, that was coined by you to be able to? So please enlighten us. It's strange in the Nigerian medical space. Even doctors will align their thought with mine that healthcare facilitators, it's strange.
It's not strange because we don't have proper understanding of medical tourism. We don't really know the concept of medical tourism because in this part of the world, we don't know healthcare business. If you go to India, there are schools you can go and learn a medical tourism business. Yeah, if you go to Turkey and other top-ranking medical tourism destinations, it's there in their curriculum as a course that you can study it. So it's not a new thing. It's because in this part of the world, we don't understand medical tourism business. So that is why we're always busy condemning medical tourism, while other countries are busy reaping the benefit of medical tourism.
All right. The vice president have come out to say that Nigeria is doing well in terms of its medical tourism strife, and it's we have seen a lot of patients from USA and other countries coming into Nigeria for kidney transplant, which you've disagreed on already.
I did not disagree. I said it may be true and it may be no.
Okay, so let me leave it at that probability statement of yours.
Yes.
But then again, looking at the statement, you said you are a health facilitator,
specialist or consultant.
A consultant. Looking at the ratio of Nigerians traveling abroad and Nigerians getting treatments even here in Nigeria, what will you say generates the highest revenue for Nigeria in terms of medical health in general?
Okay. To be realistic, people travel from abroad to Nigeria for medical treatment. If you look at the definition of medical tourism I give to you, that is not all about traveling from less developed country to well-developed country.
It can be the reverse.
It can be from developed country to less developed countries.
Okay.
Now, for example, you see US citizens travel to Malaysia, for example, for medical treatments in good number. In terms of development, you cannot compare US and Malaysia. So to be honest with you, there are many of our local healthcare service providers doing greatly well. We have visited many facilities in Nigeria that are very good. But the challenge they are having is that they don't have the platform to be known. The environment is not there, you understand, for them to be known. And that is why we are even coming up with initiative that will make our local healthcare service provider to move from domestic excellence to global recognition.
Are you saying the Ministry of Health is not doing that already?
See, you cannot give what you don't have. In law, they say you cannot give what you don't have. Our honorable minister is doing wonderfully well in his own way as a clinician or as a medical personnel. But he's supposed to involve people that specialized in business aspect of medical. He cannot do all. If you go abroad, I've been to India several times, I've been to Turkey, Egypt, Egypt, Jordan, Algeria, and all these countries. And we look at the way the healthcare is running. There is a lacuna between the way healthcare is running abroad and the way it's running in Nigeria. Now, let me clear you. Whenever they have any event that has to do with healthcare business, last time they hold one event in Villa, which the theme of the program is Unveiling Nigeria Health Sector Renewal Investment Initiative. All the people that came, even from abroad, you can't find any medical tourism specialist among them. I mean, people that specialize in aspect of medical. They are all, I can say almost all are clinicians. I follow the program from A to Z. They are clinicians. They are not trained for business. That aligns my thoughts. This is strange. Yeah, they are not trained for healthcare business.
That means this your field that you said is strange
in Nigeria.
In
Nigeria, but
system.
See, medical tourism has been there for years. You understand? Yeah. Medical tourism has been there for years. But in Nigeria, there is one mentality or one habit we form, which is very bad. What is that habit? Anything we hate it with passion, and we don't look the other side of it. And that is seriously affecting me and some of my colleagues that are coming from abroad to Nigeria because of the negative impression, the bad impressions we have about medical tourism. Whenever you are meeting any of our local healthcare service providers and you are talking about medical tourism, they don't always like to give listening ear. Because what they think is that you are coming to discuss with them on how to take patients abroad. And they don't know that medical tourism is all encompassing. That is why I'm here at this time to debunk the understanding of Nigerians or Africans about medical tourism. Medical tourism is the good things. And in fact, we need to embrace it with two hands because medical tourism is the solution or is an antidote to the problem we are facing in Nigeria health sector. Not only Nigeria, Africa, and the world at large.
If you are rightly saying, that medical tourism is the solution, panacea, to the Nigerian problem,
health sector
problem.
Yes.
Like you've said. Then I'm tempted to ask, do you have like an association or a union of medical tourists, even in Nigeria?
No, we don't have at the moment, and we are trying to form the association. No, one person cannot stand and form an association. So now we are looking for the like minds to come together so that we can form an association of health tourism.
That's quite interesting.
Because medical tourism, we are trying to introduce in Nigeria. Do you know that it has enormous benefit for the country? It has like 8 benefits for the country. And the benefits of it are: 1, it will go to reduce the rate of outbound medical tourism and mean people traveling abroad for medical treatments. 2, it will go to reduce the issue of brain drain syndrome. Our medical personnel relocating abroad in good numbers. Because where they are traveling to practice, like UK, US, Saudi Arabia, and another medical tourism destination, is because they embrace medical tourism. So another thing again, to create jobs opportunities, investment opportunity, it will yield us foreign revenue and make us to even save money that people are taking abroad to spend on their health. And lastly, it will increase our GDP ratio.
Well, what you've just said, by your definition, that medical tourism has to do with people traveling from one destination to another. Now, without adequate regulation, don't you think that this sector can be hijacked by quacks and hijacked by people that don't even have an understanding of what medicine is all about, and as such, the process will be abused?
Yeah, that is why we talk about policy. So if policy is big and this is inclusive, and there will be anybody that misbehave, or if there is any body that goes out of the law or the rule, you understand, it can be dealt with.
Don't you think that this is the reason why the Nigerian medical practitioners will not want to be identified with the medical tourism purview, because they see it as a system that doesn't, to a large extent, align with the medical practices, the medical field visions?
You see, what you don't know, senior you. If it is A, B, C, D, and you don't know it, it's senior you. So I know they have fear of extortion. You understand?
Yeah.
But whether we like it or not, medical tourism, they don't want to hear about it. You understand? Is the only way out of the solution. Is the only solution to the problem we are having. And everything in life that have positive side always also have negative side. But you consider it. If the negative side, you understand, is lesser than the positive side, you need to embrace it. You understand? Because life itself is full of risk, and there's no reward without risk, and reward goes to those who take risk. So it's not even risk, because most of the countries do well. Okay, name one country worldwide that is doing well medically, that is not participating in promotion of medical tourism. Is it US? Is it India that is the biggest beneficiary of Nigeria or Africa market? Is it Turkey? Is it United Arab Emirates? Is it Egypt? Is it Jordan? Is it Thailand? Is it Singapore? Is it Mexico? Is it Cuba? These are top-ranking medical tourism destinations.
All right, just before I let you go, exposing Nigerians to medical tourism will further ridicule the Nigerian medical sector to a very large extent, in the sense that at this point, like you've said, people will be moved, facilities will be moved outside the countries. Of course, people will be introduced back to Nigeria. People will be moved to Nigeria also. So it's a two-way traffic. Yes. But I'm asking, in terms of going out for medical tourism, people say as a profession, as a facilitator, health facilitator, which you are, if we introduce the medical tourism on a large scale, don't you think at this point it will further dilapidate the Nigerian healthcare sector?
It's not true. It's false. We always talk of healthcare investment, healthcare financing. The only thing that will bring these investors we are talking about is by us embracing medical tourism.
More Nigerians will be traveling out. If you look at it, if it's a two-way traffic, are you talking about?
No. What I'm trying to say is that we will focus more on intra-band, which is domestic medical tourism, and in-band, people coming in. But whether we like it or not, people will still travel abroad for medical treatment. The reason why I say so is not hard to know. There are some cases, there are some procedure that we cannot handle in Nigeria. One of it is liver transplant. There's no hospital in Nigeria that can do liver transplant, heart transplant, pancreatic surgery, robotic surgery, serious neuro and spine related cases. and etc. So if we have case now, for example, now we have a case of a woman having breast cancer and you need to undergo oncoplastic surgery. For example, now in the country, we don't have a center that can do oncoplastic surgery. Are we going to leave the patient to die? For example, we have a case of liver and there's no hospital in Nigeria that can do the transplant. Are we going to leave the patient to die? So we're saying that, okay, because of our, we bias in this country and it's not fair. It's not fair because anything we cannot do, you understand, we have to take the patient, you understand, to where there is capable hand. You understand? So whether we like it or not, and do you know that it's no longer in news that Nigeria loses no less than $2 billion to outbound medical tourism annually, and the Africa loses over $2 billion to outbound medical tourism annually. So it means Nigeria alone constitutes 70 to 80% of the expenditure. And the only thing that can help us to save this cost is by us to embrace medical tourism, so that we can start retaining this money going out in Nigeria, and people can start coming from other countries to Nigeria for Medicare.
Mr. Usman,
Yes, sir.
lastly, the advantage, as a way of x-raying the medical tourism, the advantage, does it outweigh the disadvantage?
The advantage of medical tourism is 90%.
Invariably, does it have any disadvantage?
It has disadvantage.
Can we hear the disadvantage a few?
Okay. The disadvantage of medical tourism is extortion, like as we said.
Yeah.
Like some of our patients going abroad, at times they browse online to get some fake hospitals or some facilitators. They can connive with some foreign hospitals and do patients. And two, some cases has already gone out of hand, you understand, because most of the cases we take abroad mostly are cases that almost got out of hand. For example, you see a patient, you understand that the family members has already lose hope that this patient will, at times in airport, as they even land in the airport, some patients will give up. You understand, because of the stress involved in traveling abroad. So the disadvantage of it are few, but what I'm trying to tell you, the advantage of it is like 90%. Yes.
Well, it's a very interesting conversation, and we must keep having this conversation, Mr. Usman, even on the desk, so that we'll get to also cross more T's and dot more I's. A lot of questions that are begging for answers, but by time I'm being signaled right now that it's time to go. But then I want to say thank you so much for being a part of the show today.
Thank you, my brother. You're welcome.
Well, we'll still keep that conversation going because we have to bring you back here to talk more on medical tourism. Well, at this point in time, I want to say thank you so much, my viewers, for being a part of the show. Do remember that you can join the conversation on our various social media platform. Of course, you can also join on the repeat of the program even here on Global Television. My name is Godwin Sunday, and from all of us here on the desk, I want to say, do remember that peace and unity are the pathways to progress. From all of us here, it's bye for now.